In this presentation, you will likely hear some things about prostate cancer screening that you've not heard before. Some may seem surprising. A few questions to keep in mind that will be discussed in this presentation are, first, has prostate cancer screening been proven to save lives? Second, can prostate cancer screening ever cause harm? And third, what do experts recommend about prostate cancer screening for men aged 50 to 74?
Ron is 50 years old and in for a routine checkup. The exam is complete, and the doctor is going over tests he is recommending as part of routine preventive care.
Your exam is totally fine except for your weight. I'd like to see you lose about 15 pounds before your visit next year, and maybe do at least 30 minutes of brisk walking 5 days each week. I'm going to refer you to a dietitian to help you figure out how you can cut some calories from your diet. Is that okay?
Sure, I think I can handle that.
You're up to date with colon cancer screening, so you don't need to do anything about that. I've also ordered a cholesterol check. It's been a few years, and it's probably a good idea to check it again.
Okay, but what about the test for prostate cancer? I thought I was supposed to get that too.
Well, I don't routinely bring up prostate cancer testing with my patients because the U.S. Preventive Services Task Force, that's an organization I really trust, says not to do the PSA test for prostate cancer for cancer screening in most men. When people ask, I usually have them meet with a health worker to review the information and decide what they want. But it looks like my next patient canceled and I have some extra time. Do you want to talk about this now?
Sure.
Okay. Well, the first thing you should probably know is that it's not clear whether PSA screening saves any lives.
What? How can that be?
Well, the idea with screening is that if you find cancer early and treat it before it has spread, you cure it and save lives. Everyone, and that includes doctors and patients, has always believed that. But it turns out things don't always work out that way. Most men with prostate cancer die from something else. And the studies of screening have found few, if any, lives saved.
Boy, that just doesn't make sense.
I agree. But even though it doesn't seem to make sense, it seems to be true. Plus, a lot of men are harmed by treatment. That's why the U.S. Preventive Services Task Force has recommended against screening for most men for prostate cancer, even for men with higher risks, like African American men and men whose fathers or brothers got prostate cancer when they were younger. They say the evidence currently doesn't support screening.
Well, who is this task force you're talking about? I've never heard of them.
Who is the U.S. Preventive Services Task Force? That's a good question. The task force is a group of volunteer medical and scientific experts. It was established by Congress in 1984 to review the evidence and make recommendations about preventive care for the health of all Americans. Members aren't allowed to have conflicts of interest like making money from doing the medical procedures they are evaluating. They look at the facts about the benefits and harms of medical tests. If the facts show a test does a lot more good than harm, they recommend that people get the test. But if they find the facts show a test like PSA does more harm than good, they recommend that people do not get the test. They advise men not to get tested for prostate cancer because they say studies show that men are more likely to be harmed than to get any benefit.
So they recommend colon cancer testing, but not the PSA test for prostate cancer?
Exactly. They recommend cancer screening only when the benefit of getting the test clearly outweighs any harm that may come from testing.
How can a blood test cause harm?
It's not the test itself. It's the tests and treatments that doctors may want you to have if the test shows a possibility of prostate cancer. It's not a perfect test, and it can be high and cause worry even when there is no prostate cancer, which is a real harm. A high test can lead to other testing, like a prostate biopsy, which is painful and can have complications like infection. Those are other harms from PSA testing.
That doesn't sound so good.
No, but that's not all. If the biopsy shows cancer, these men live the rest of their lives knowing they have prostate cancer and worrying if or when it will harm them. Men frequently get surgery or radiation treatment that hardly ever really helps them live longer, but that often leads to serious complications.
So getting tested can lead to all those things I don't want that may not help me?
Yes, it's kind of a slippery slope and not one I want my patients going down.
Whoa, that makes more sense now why maybe getting tested might not be the best thing to do.
Also, the PSA does not pick up every prostate cancer.
So even getting a normal test doesn't guarantee I don't have prostate cancer?
That's right, unfortunately. Let's take a look at the big picture. Prostate cancer is common in men like you. Currently, about 16 out of every 100 men are expected to be diagnosed with prostate cancer sometime during their lives. However, about 3 out of 100 men are expected to die from it. About 1 out of 5 men who get prostate cancer.
So most men with prostate cancer don't die from it?
Right. Even if you do have prostate cancer, most of the time it never causes you any harm because it tends to grow slowly and occur in older men. So most men with prostate cancer die from something else, not the prostate cancer. Many would never know they had it if we didn't test them for it. Well, some would get diagnosed because it does affect them, even though they die from something else. Getting diagnosed with and treated for a cancer that would never have affected you are real harms. So is getting treated earlier than you needed for a cancer that would eventually affect you.
So why would anyone bother to get tested for prostate cancer?
Great question. Prostate cancer isn't always slow growing. Remember, almost 20% of men who get prostate cancer will die from it. Some other men will have problems from it even though they die from something else.
So the chances of getting a deadly prostate cancer are small, but not exactly zero.
That's right. Some doctors think that by doing the PSA test, they can find these bad cancers early, treat them, and prevent some men from dying from prostate cancer. Finding and treating a cancer early seems like it should save lives. But in this case, it does more harm than good.
Let's go through the numbers in a little more detail. That may help you understand the harms better and why the task force feels that even if there is a benefit to a few men, the risk of harm is much greater. Out of 1,000 men screened over 10 years, we think about 110 will get diagnosed with prostate cancer.
In recent years, 90 or more of these 110 men would get treatment for prostate cancer, usually meaning surgery or radiation. Of the 90 or so men who get treatment, about 50 will have a serious complication from treatment. About 29 men will become impotent. They lose the ability to have normal erections.
About 18 out of the 90 men treated will develop trouble holding their urine. This may require them to wear pads in their underwear to catch leaking urine, or even adult diapers.
Without screening, 5 men would be expected to die from prostate cancer over 10 years. With screening, at most, 1 man is saved. And maybe none. There are also complications that can happen right after treatment, like with any major procedure. Infection, blood clots, things like that.
So the chances of getting a benefit from PSA testing are at best 1 in 1,000 over the next 10 years, and the chance of getting side effects from a treatment I don't need is much higher than that, like 50 out of 1,000?
Unfortunately, that's right. Currently, if you get PSA testing regularly for 10 years, you are at least 50 times more likely to be harmed than to benefit.
Boy, those aren't great odds. But there's something I don't understand. Why do they have to treat those men who have slow-growing cancers? Can't they just leave them alone and treat the guys with the bad cancers that are likely to hurt them?
Great idea, but not so easy to do. When a cancer is found on a biopsy after a PSA test, we are not able to tell for sure which cancers will end up causing trouble and which ones won't.
Boy, that is a problem.
These days, some doctors tell men they can just keep an eye on the cancer if it does not look too bad under the microscope. But it's not so easy living with the idea you have a cancer in your prostate.
Yeah, like maybe a ticking time bomb. I think I might just say, take out the cancer and get treated.
That is what most men end up doing, even if they initially decide to wait and watch.
So why have so many men been getting tested?
The American Cancer Society and other groups used to recommend that men get tested regularly with the PSA test. But that was before doctors started to identify all the harm that can also come from finding a cancer early. When you combine that with learning that very few, if any, men's lives are saved by all the testing and treatment, it changes how a lot of people think about this. Groups like the American Cancer Society now do not recommend routine PSA testing. They say that starting at age 50, every man should learn about the benefits and the harms of testing and then make his own decision about PSA testing.
But what should I do if I'm high risk?
African American men and those with a father or brother who had prostate cancer when they were younger have a higher risk. Other cancers in the family, though, don't seem to mean a higher risk of prostate cancer. But figuring out what higher risk men should do is complicated. For higher risk men, if there is a benefit from screening, it will probably be larger. But the harms will probably be larger too. So the balance may not be very different, but no one knows for sure.
So what should I do?
The task force says, don't get tested with PSA, as it's more likely to harm you than to help you. They base their recommendation on the best facts we have now. The Cancer Society and other groups say, learn about the benefits and harms of PSA testing and then make up your own mind. They think some men may be willing to accept all the harms to get the possible benefit.
So the bottom line is I have to look at the odds PSA testing may save my life against the odds it will end up getting me a treatment I didn't really need and all the side effects from that, right?
Right. I can tell you, for some of my patients, the decision is a no-brainer. 50 to 1 or worse are not great odds. But other patients really want to do everything they can to live the longest possible healthy life and are willing to risk the downsides of getting PSAs. Maybe in 10 years we will know better how to deal with prostate cancer, but right now there are a lot of unknowns.
I'm thinking I may want to wait on prostate cancer testing until you all can give me better odds.
I hear what you're saying and totally support your decision not to get a PSA test right now. That's exactly what I recommend to the men your age in my practice. But doctors don't all agree. If you asked another doctor, they might say something different. That's why I encourage men to learn about this and make their own choices if they're thinking about it.
Okay, well, maybe next year you'll have something better to offer for prostate cancer.
I hope so.
See you next year.
15 pounds lighter?
I hope so.